We often get phone calls asking us what their options are if they're missing a tooth. If you're missing a tooth, you pretty much have three basic options to replace that tooth. One is to do a partial denture or something that's removable, something that comes in and out. So if you look at this slide here, this option down here shows a tooth and it shows pink acrylic. This can be acrylic, it can be clear, it can be metal based, okay? But it's something that's removable. Now you see this little metal clasp back here. So this slides into place and it's removable. You can take it in and out. The advantage to this is it's the cheapest way to get a tooth in your mouth. The disadvantage is it's removable. It does not function like natural teeth, and where these clasps here connect onto the remaining teeth, as this thing rocks and moves in your mouth, it does damage to those teeth. So typically a one tooth partial will turn into a two or three tooth partial, and so forth and so on. Now the other option that you have is to do a bridge, and for a long time this was the gold standard. You have a tooth missing, you have a tooth on each side that's prepared for a crown. So you have a crown here and a crown here, and you fuse a crown in the middle connected to them. And all this goes in and seats on top of these, and it cements. So the advantage to this is it's permanent. It goes in, it stays in, it's not removable. It's very cosmetic. You can make this out of very cosmetic porcelain. What's the big disadvantage here? The big disadvantage is where you're missing the tooth, you continue to get bone loss. Now, if you continue to get bone loss, this is what causes the bridge to fail. Because when you lose bone here, the root, that's very soft structure underneath here, becomes exposed. And that's what causes the bridge to fail, because you expose the root because of the bone loss. Third option, obviously, is to do an implant. This image shows doing an implant, where you have all three parts of the implant shown. You have the dental implant, which replaces the root of the tooth that used to be there, the abutment that then screws on top of there. Its purpose is to hold the tooth or the crown, and here's the crown. So that all goes in. The advantage is I don't have to touch any of the adjacent teeth, and the biggest advantage is it's the only option we can do that stops the bone loss where that missing tooth is.